Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Prasasti Nurmalita Pasya. Today, I'm going to give a presentation about dietary management in hypertensive patients. The presentations will be in 5 parts. The first is about the definition of hypertension. The second is about etiology of hypertension. Then we will talk about the risk factor for hypertension. Four is about the dietary goals, and the last is about dietary requirements. Okay, the first is about definition of hypertension. What is hypertension? Okay, hypertension or high blood pressure is one of the most common diseases in developing countries like Indonesia, known as the silent killer because it rarely has any obvious symptoms. Hypertension usually has no sign and symptoms. Symptoms that often appear are headaches, a burning feeling in the neck, or a heavy head. However, these symptoms cannot be used as a benchmark for the presence or absence of hypertension in a person. The only way to find out is to have your blood pressure checked. There are various kinds of high blood pressures limit to be called hypertension. According to the World Health Organization and the Joint National Committee, the definition of hypertension is a steady blood pressure of 140 over 90 millimeters of mercury, measured at rest. The definition of hypertension means that the systolic blood pressure is always above 140 and the diastolic pressure is above 90 millimeters of mercury. The ideal blood pressure is if the systolic pressure is 120 and the diastolic is 80 millimeters of mercury. So that is for definition. Now let's turn to etiology of hypertension. Okay, what is the etiology of hypertension? Based on the cause, hypertension can be divided into two, namely that which can be changed and which cannot be changed. Factors that cannot be changed include age, gender, and ethnicity or race. Meanwhile, what can be changed are body weight, physical activity, smoking habits, stress, drinking alcohol, and unhealthy intakes such as foods high in salt but lacking vegetables and fruit. And that brings me nicely onto my next point. The third point is about the risk factor for hypertension. The risk factor for hypertension are age, race, gender, obesity, lack of physical activity, smoking habits, and consumption of alcoholic beverage and another factor. Okay, sorry. The first risk factor for hypertension is age. Sorry. Age. The incidence of hypertension tends to increase with age. The type of hypertension that is often found in the elderly group is isolated hypertension. However, hypertension does not always go hand in hand with the aging process. And the next, there is stress. Everyone has the same possibility of experiencing hypertension. African Americans tend to experience hypertension more quickly and experience more deaths from hypertension, like coronary heart disease, stroke, and kidney damage. And the third, there is gender. Men are more at risk of experiencing hypertension than women when they are before 45 years old. Conversely, at the age of 65 years and over, women are more at risk of experiencing hypertension than men. This condition is influenced by hormones. Women who are entering menopause are more at risk of experiencing obesity, which will increase the risk of developing hypertension. And the next is obesity. Someone who is obese or overweight has a greater risk of experiencing pre-hypertension or hypertension. The indicators commonly used to determine whether someone is obese are through measurements of BMI and abdominal circumference. And fifth, there is lack of physical activity. Physical activity is very beneficial for the health of the body, especially the heart and lungs. Physical activity also nourishes blood vessels and prevents hypertension. Efforts to prevent hypertension will be optimal if active physical activity is accompanied by a healthy diet and quitting smoking. And the sixth point is smoking habits and consumption of alcoholic beverage. Smoking is the most preventable cause of death and morbidity. Chemical substance produced from burning even the digestive organs. In addition, consumption of alcoholic beverage can also increase blood pressures. Research show that the risk of hypertension doubles if you consume more than three drinks a day. And the last point is another factor. Family history of sufferers also increases the risk of developing hypertension. Prolonged stress can also increase a person's risk of developing hypertension. And the next point is about dietary goals. What is the goal of the diet? The DASH diet aims to lower blood pressure in hypertensive patients and can be used as a preventive measure against hypertension. DASH diet can be used with the aim of weight loss therapy and lowering cholesterol levels. And the last point in dietary requirements. There are 9. Okay. And the last point is dietary requirements. What are dietary requirements for hypertensive patients? There are 9 dietary requirements for hypertension patients. The first is enough energy. If a patient with a body weight of 115% of the ideal body weight is recommended for low-calorie diet and exercise. Second, adequate protein adjusting to needs of the patient. Third, enough carbohydrate adjust to needs of the patient. Fourth, limit consumption of saturated fat and cholesterol. Fifth, sodium intake is limited to under 2,300. If blood pressure reduction has not reached the target, it is limited to 1,500 milligrams per day. And the next is consumption of potassium. Potassium 4,700 milligrams per day. There is a relationship between increased intake of potassium and decreased intake of NAK ratio with decreased blood pressure. And seven, meet the needs of daily calcium intake according to age to help reduce blood pressure. Calcium intake above 800 milligrams per day can reduce systolic blood pressure by up to 4 and 2 diastolic blood pressure. And the next is magnesium intake meets daily requirements or DRI and can be supplemented with magnesium supplementation of 240 to 100 milligrams for a day. Can reduce systolic blood pressure 1.0 to 5.6 millimeters of mercury. And the last is in hypertensive patients with other comorbidities, such as chronic kidney disease with hemodialysis or hepatic cirrhosis, the dietary requirements and principle must be modified or adjusted to the disease condition. Okay. Before I finish, let me just summarize the main points. To start implementing the DICE diet, you don't need special meal arrangement and recipes. Cooking and food ingredients that are commonly used daily can be used by replacing food ingredients that are usually consumed with foods that are high in potassium, magnesium, calcium, fiber, and protein. Do an assessment of consumption patterns every day before starting the DICE diet. Observe what you usually consume every day for 1 to 2 days, then compare it with the recommended food plan for people with hypertension. And this is the references. Okay, that's it. Thank you for your attention. Stay healthy. Have a nice day and goodbye. Wassalamualaikum warahmatullahi wabarakatuh.